Welcome to TrendTalk podcast. I'm your host Naseem Balani. Today we are going to explore a treatment that is going to be life-changing for so many people struggling with chronic back pain, sciatica, or other disc-related issues. And this treatment is spinal decompression therapy. We are joined by an expert in this field who is going to explain to us how this therapy could help you and someone you love. Our guest today is Dr. Brad Deakin.
Hi, Naseem.
Hi.
I'm happy to be here.
Thank you for coming.
Your show is getting quite a following, so I'm happy to be one of the original guests on it.
Thank you so much. Thank you.
I'm happy to be here.
Thank you. Dr. Deakin has over 20 years of experience in this field, and his clinic is also very famously known for treating people who might be struggling or suffering with pain from disc bulges, herniation, sciatica, and spinal stenosis. Our research shows that Dr. Deakin's clinic, Burlington Spinal Decompression Clinic, has the most advanced technology and procedures available to help people actually try and avoid spinal surgery by utilizing this unique treatment that we are going to be talking about today. So please help me welcome Dr. Brad Deakin on our podcast.
Thank you again for being here. Yeah, I'm super excited to be here to share some of the newest innovations in spinal care, because our traditional medical model is not really fantastic at dealing with these things. So we're really happy to be here so we can bring forth some of the newer advancements in the field.
And I was just going to say that we've chosen a topic which is very important because we know a lot of people are suffering from back pain and spine health. So that's what the topic is all about. And the treatment that you're going to talk about is also very unique. I'm not sure if many people are familiar with this treatment. So let's start from the very beginning.
Yeah, I'm glad that we can get into this. Thank you. So just like you pointed out, the World Health Organization identifies lower back pain as the #1 problem across the world.
Amazing.
So it's really important.
Yes.
And rather than just masking the problem with drugs or unfortunately surgery, we want to kind of come up with some solutions that will actually be life-changing for people. So that's where spinal decompression comes in.
Oh, wonderful. So tell us a little bit more. What exactly is spinal decompression and how does that work?
So thank you for asking, because there's a couple of different procedures that use the same name as spinal decompression. So spinal decompression in the medical field means going in and doing a surgical intervention. Non-surgical spinal decompression is where we use technologies to help us put gentle forces into the spine to create like what we call a negative pressure in the spinal joint. So I'll just show you just really quickly.
Okay.
So here's an example of the human spine. It's not real. Anyway, so in between the vertebra, so here's a vertebra and here's a vertebra. In between the vertebra is a intervertebral disc.
Okay.
This intervertebral disc is like a spongy kind of like the gristle in a steak. So it's designed to absorb shock, but mostly to allow these vertebrae to move well. So when these two vertebrae move well, the movement itself pumps water into the disc. So that movement, you can see that disc is getting thicker, right? That's really important because when you have a nice thick disc there, there's a really big hole for that nerve root, and that's where pain receptors start. So we don't want anything pressing on those nerves. And as we know, these nerves don't just transmit pain, they run all of the organs and glands and tissues. So your heart runs by the signal from some of these nerves. Your colon runs by the signal from these nerves. So if you have a nice thick disc and these vertebrae are moving well, that's fantastic. There's nothing near the nerve and the transmission of the signal is fantastic. However, accidents, injuries, and traumas cause damage to the spine. And when the spine repairs those, it puts fibrous adhesions and scar tissue around the joint so it doesn't move through its full range of motion. So guess what happens to the pumping action? It's less and less and less. So the pump doesn't pump water into the disc to keep it thick. It gets thinner and thinner and thinner. So it goes through the disc degeneration cycle, and then the nerve at the back gets compromised. So you start to feel pain and discomfort, but also that signal that goes to some very important tissues, organs and glands, it's compromised. The problem is you don't feel it right away. So you go through that degenerative cycle, and then when it's really bad, then your body says, hey, Naseem, there's a problem here. It gives you pain at the end. It's kind of like when we were younger and ate poor quality food, fast food. Didn't bother us then.
Right.
Well, it did, but we didn't realize it. It
Catches up
bothers
with
us
you, right?
now. It catches up with us. So it's the same kind of thing with spinal degeneration. And that's why we use non-surgical spinal decompression. It's a game changer if it's done properly. And I've invested the better part of my adult life to try and become an expert at this.
Oh, wonderful. That's amazing. That's very, very clearly explained, and the demonstration of it as well. So you talked about accidents happening and all that, but so what other conditions and symptoms does it normally is it treated for?
Right. Yeah. So most people have back pain at some point during their lives, and it's usually because of what you said, some kind of accident, injury, or trauma earlier in their lives. So conditions like sciatica, like you pointed out, disc degeneration is a bad one. Herniated and bulging discs. And when these discs herniate or bulge, they do press in on that nerve that comes out the side. But the dangerous part is the spinal cord that's underneath all of these bones. So I'll use this other demonstration here just to show you. So as we can see, this is a disc right here. Okay. Now forget about this red part right here. So this disc right here, if it bulges or herniates backwards, it goes right into the spinal cord that runs your entire body. And that's the stenosis that you pointed out. So it's really, really important to make sure that the spine is moving properly and through its full range of motion, to make sure there are no misalignments. And if there is scar tissue or adhesions, we want to break them up and help pull fluid back into the disc. And then it comes off of those nerves. So not only do you get less pain and discomfort, so you can enjoy your lives, the degenerative cycle is stopped and reversed. And we can actually prove it on digital x-rays, which is kind of nice.
Amazing. Very complicated, but sounds interesting.
It is very, very interesting.
Too much to grasp, though, at this point.
You're pretty bright.
At this point. So this therapy, spinal decompression therapy, can help sciatica. People, I know a lot of people already suffering from sciatica and the disc-related issues. So this therapy would help them too? Very much. And, you know, there's a lot of advancements in a variety of different professions, osteopathy, massage therapy, physiotherapy. There's a lot of great practitioners. Chiropractors are really good at this, but spinal decompression is really the next level. So the way I explain it to patients is you can go on eBay or Amazon and buy an inversion table. You know what an inversion table is? You kind of hook your feet into boots and you hang upside down like a bat, right? That's an indiscriminate force that hits your ankles, your knees, your hips, all the joints in your spine. It's helpful, but there's a reason why we have those curves in our spine. So we don't want to flatten those out, certainly from a non-professional status. Then the next level up from that is what's called traction. Traction is when somebody lies on, we call it the rack, like the Middle Ages, where you get stretched and tortured. Again, on that x-axis, it's providing an indiscriminate force that hits a lot of joints. Spinal decompression is really the best form for this because it targets specific joints in your spine based on what are called facet angles. So we can target in on a specific area, like the transition between the spine and the pelvis, for instance, the L5 disc, and we can target those specifically because we don't want to put an indiscriminate force in. We want to be very exacting and precise because that's what the patient deserves. So is that the difference between the normal chiropractic adjustments or surgery or physical therapy? I think increasing precision is really, really important. People want specialized medicine, and chiropractic care is my first love. It changes people's lives like you wouldn't believe if it's applied properly. Spinal decompression is for more specific issues that chiropractic care could treat. I've just found with my experience that it can really hone in and zero in on problems and help it a lot quicker. Oh, wonderful. But I would never dissociate the two because I do believe that you need to break up all the scar tissue and the adhesions with chiropractic care and then apply the decompression force. Okay, that makes sense. Thank you for explaining that. You're welcome. So let's talk about some of the benefits and effectiveness of this therapy. What kind of results can one typically expect from this therapy? It's very quick because when you go in for a chiropractic adjustment, for instance, or an osteopathic manipulation, two very different things. When the force goes in, it's a very quick burst of stimuli, right? So you get a couple of minutes of neurological stimuli at most with 3 or 4 adjustments because it's a very quick stimuli. Now, the results last for longer, but spinal decompression,
you're on the decompression table for at least half an hour.
Okay.
So you're getting 30 minutes of a stimuli that's designed to change something, right? So the longer you get a stimuli, the more likely it is to have a long-lasting hold. So typically we find after the third or fourth visit, people really start to kind of hit their stride. They start to say, hey, look, this really feels good. But it's like COVID. You remember COVID, right?
Right.
We were all locked
I do.
away. We
Yes.
sat around. We didn't exercise as much as we probably should have. We
Yes.
ate foods. So going back to the gym, it was a little tough, right? It was tough to go back into it, so you were sore the first couple of visits. Spinal decompression can be that for some, but most people get a very, very fast response. Usually in the first visit or two, they start to notice a significant improvement.
Oh, that was going to be my question to you.
There
How
you go.
long does the patient begin to feel relief, and how long do the results last?
So the first couple of visits, they notice, hey, I feel more range of motion, I feel better. And then all of a sudden their body says, hey, look, the mechanics are way better. So pain disappears very, very quickly.
Okay.
But that's the dangerous part, because we don't want to just make pain go away, because you can do that with
You need to
pharmaceutical
treat it,
products.
right? Yeah,
Even marijuana is legal these days, right?
Yes.
We don't want to do it by substances. We want to make sure the mechanics are better.
Right.
So the longer we have better mechanics in, the more likely it is the nervous system will adopt it as its new pattern. So we don't want to just quit when you're at a discomfort. We have to do it for a little while for it to really sink deeply into your nervous system.
Yeah, that makes sense, right? And what kind of lifestyle changes would be necessary in order to either maintain or enhance the benefits of the treatment?
Right. So that's the part where it becomes my responsibility.
Right.
So the lion's share of the problems or the lion's share of the therapy is my responsibility as the provider. A person doesn't have to do too much. They have to obviously make their appointments on a regular basis, not 1 week here, 3 weeks later, 4 weeks later when they're in pain or discomfort. We want it to be somewhat regular. It's like playing the piano. If you're going to learn how to play, if you're going to learn how to play the piano, doing it for 5 minutes a day is better than just doing 1 hour on a Sunday.
Exactly.
Right?
Very
so
true.
repetition is important. So that's the first and foremost. A person has to make their visit schedule as determined by their provider. The second thing is we don't want them to tax their body with doing a lot of work at the beginning, because we're trying to make significant changes in the body and in the spine.
Okay.
We don't want a person, once they start feeling really good, trying to be a superhero, like going and running an Ironman or doing, a 400-meter swim or anything like that.
Yeah.
We'd want them to minimize impacts for the first little while. But generally speaking, people get a very, very, very quick response. And we're very lucky in our clinic. We have like profession-leading technology, as you mentioned.
Yes.
We have like a lot of experience, but I've also done a lot of international work, and we've received a lot of awards for those. So we're quite blessed.
Very nice. Very nice. Good to hear. So I guess lifestyle changes includes eating, drinking.
Absolutely. Not drinking.
Well,
drinking water.
Well,
and
I'm saying eating, the right kind of foods. I
Right,
mean.
exactly. So we want to try and stay away from acidic foods.
Yes.
Are important.
Yes.
There's a variety of problems with acidic food. Lots of hydration with non-caffeinated, non-sugary beverages. Alcohol is a no-no. Things like smoking, nicotine consumption. We really want to try and have the body the way that the
It's
boss
meant to
designed
be.
it.
Yes,
Exactly.
yes,
With as little commercially prepared products as possible.
Yeah.
Because we go to the grocery store now, most of what's in the grocery store is a commercially prepared product rather than food. So, leaning towards organic, non-inflammatory foods, that kind of thing.
So that reminds us, a great reminder that healing is a whole body process, right?
100%.
Yeah. So in your opinion, doctor, who is a good candidate for this treatment and who's not? Are there any age limits or lifestyle factors or medical conditions that would determine a better or a worse fit?
I believe that we should have our spines checked essentially immediately. Well, immediately meaning as soon as a person is weight bearing and they can walk by themselves. One of the great things about wearing a diaper is that, hey, look, there's no mess anywhere, but also it provides a little bit of padding, because learning to walk, how many times did we fall learning to walk?
Exactly.
Right. 20 times a day for, a month or two, that's a lot of trauma to the spine. So as soon as a child is walking and they can sit still for half a second while we take imaging.
Yes.
I think that's really important, because if we can avoid problems when a person is young, or correct problems when they're young,
Right.
when they're older and they go through that growth spurt during adolescence, we can avoid a lot of issues.
Exactly.
But especially after a
Prevention
person's been
better
in a
than
trauma.
cure, right?
Exactly.
So, yeah, right. Thank you for breaking that down for us.
My pleasure.
About the process itself, what does a typical spinal decompression therapy session look like?
Okay, so first and foremost, I do think it's important for a chiropractic and adjustment. And the word adjustment is very specific to our profession. It's not a manipulation. So a chiropractic adjustment is very important to break up the scar tissue and the adhesions, to get the vertebra moving well through its full range of motion, to restore the curves and the mobility to the spine. So that's very, very important. And then we put somebody on the decompression table. Now, we have what's called 4-dimensional non-surgical spinal decompression at our clinic. So 4-dimensional means the x-axis. So we put in a distraction force. So let me just use the spine here. So we have somebody on the decompression table. And let's say, for instance, we want to target this joint right here, or this one here. So we put them on the table, and we belt them up in certain ways. And we can basically go like this, and we can separate those vertebrae like that.
That sounds
target
painful.
them specific. You know, it's a great, it's actually not painful. We have ladies in the practice right now that are 95 years old. They've had problems all their life, and we get them involved with spinal decompression, and it makes a massive difference, even though they're 95 years old. So they can get their mobility back. They can be pain-free. You know, with their doctor's consent, they can start decreasing the amount of medications that they take. So it's quite impactful. So we put in this decompression force here that helps the discs re-engorge. So we can also do what's called trunk flexion, where we can put the spine up like that, because most disc problems happen towards the back, where the nerve roots and the spinal cord are. So if we can put them into trunk flexion and do that decompression force, it's even more specific. Then if a person has a spinal curvature one way or the other, we can either bend them like this or like this while they're on the decompression table.
And that doesn't feel invasive?
Not at all. Not at all. Most people have little naps, half an hour sleeps while they're on there. Everyone likes an afternoon nap. And we can also do what's called a rotational decompression, where we can go like this. We can turn the spine, because if the brain is used to the spine being like this, we want to do the opposite to try and change that neurological pattern. So the 4-dimensional non-surgical spinal decompression that we have at Burlington Spinal Decompression, it's really a game changer for people.
That's what cycles mean, right?
Yes. Yeah.
Right. So I was thinking, it doesn't, you said it's not painful, it's not invasive. That's reassuring for people who are going through so much pain day in and day out. And the timeline sounds refreshing for someone who's looking for lasting relief.
Exactly. And lasting relief is a great topic to bring up, because the post-surgical failure rate is as high as 46%. So some studies show that 46% of people that have lumbar surgery within 5 years have as much pain or more as they had before the surgery. So we want to exhaust all non-surgical methods before a person jumps to spinal surgery.
That's so encouraging.
Absolutely. So this really is a game changer for most people if it's done properly.
I'm really happy. I think people will be encouraged to, especially those people who are nervous about trying something new. This will help them at least investigate into it further.
And that's the most important thing, investigation. So here's the thing. With AI, we're entering a period that will revolutionize human being or human existence within 5 years.
And what does that
This
mean?
is going to be the most significant change in human history within the next 5 years. Here's an example. So I was sitting down the other day, and I said, okay, I took a picture of myself and I uploaded it to AI, and I said, make me better looking. And all of a sudden it spit out this picture, and I was a lot better looking than I am right now. And I was like, wow, this guy's actually good looking, but sadly, he doesn't look anything like me.
It's not me.
But it was me. So that's the challenge that we face over the next little while, is with the incorporation of AI, people are not going to know what's truth and what isn't.
Okay.
I mean, we can just pull up a Facebook feed right now, and there's so much on there about what's going on politically in the United States and the challenges we're facing in the Middle East. People don't know what's true anymore. So I believe it's important to have these kinds of conversations so people can say, hey, look, does this person sound like they know what they're doing? Do they have the right experience rather than just reading something on the internet? You know, the experience that a person has when they meet somebody that loves what they do.
Right.
I think it's a very, very different experience.
I was going to ask you, you know, with this demonstration, I'm sure people will be encouraged to learn more about that. What kind of advice would you give them as to how do they know that they are actually getting high-level care from their trained professionals? So you touched upon that. Yeah.
So I do think that, you know, clearly you love what you do. You love this, and that's why you're so good on camera. So I think people can witness that kind of thing right away. I think they can also see that in their healthcare provider, and it's important to see that. Do they love what they do? Because if they love what they do, they're going to put all of their passion, all of their energy, all of their time trying to become better.
Right.
You obviously want to make sure they have enough credentials behind them.
Exactly.
And I would also say, okay, well, what other work does this person do? Are they on international advisory boards? Have they written any peer-reviewed journals? You know, that kind of thing. I think that's really, really important because somebody can love what they do, but they might just be starting out at it. So I think experience weighs in. Experience, technology, and a love of what they do, I think is the best recipe for choosing a healthcare
That's
provider.
very useful. I think it's useful for people to understand, gain confidence as to how they go about choosing the right service provider.
Absolutely, for sure.
I wanted to ask, is there any risk associated with this treatment, and are there any side effects to it for that people should be aware of?
Well, the risks are very, very minimal, and that's a great question because I think people want to know. People think that once they have some kind of spinal surgery,
they can jump around.
They can jump around and everything. You wouldn't want to have that happen. But it really goes on a case-by-case basis. We can't just say this is appropriate for everybody because it's not. That's why you go to the provider. So imaging is really, really important. I believe, personal belief, that anybody that gets any kind of care to their spine should get imaging first. You know, faith is for Sunday. Faith is for your spiritual walk. It's not for healthcare diagnosis. We want to make sure that the person knows. So for instance, if you were the patient, I would want to know what kind of accidents and injuries and traumas you've had in the past. Do you have any other healthcare conditions we need to be worried about? You know, are there any medications that you're on? What do the images look of your spine? And are those images something that would be improved through spinal decompression? So it's really on a case-by-case basis.
Kind of research before you get into the treatment itself, right?
But the good thing about it is these non-surgical spinal decompression forces are so gentle that almost everybody that has a spinal problem would be able to try it. But again, you want to go to an experienced provider first that takes imaging. I think that's quite important.
You touched upon a little bit about that, but my next question was going to be specifically for spinal decompression therapists. What kind of questions would someone ask if they were looking for one?
I think sadly, most people are more concerned with how far it is away from them because convenience is a big thing, but convenience is very problematic for healthcare. You want to go to the profession. So if I was looking for one, I would say, again, you know, how much experience do they have? What kind of technology do they have? Do quite a bit of research. I think that's quite important.
And the passion that comes with it, which I can see in your